Senior PharMassist conducts medication reviews or medication therapy management with all of our participants on a 6-month basis, and we do it for a couple of reasons. Number one, in the United States, for every medication we take and pay for, we spend $1.36 fixing problems caused by medications. So we feel like in order to maximize people's health, we need to make sure they're on the medicines that are doing more good than harm. So what happens is they come into our office, they bring all of their medicines, prescription, over the counter, as well as herbal products, and they sit down with a clinical pharmacist trained in geriatrics to make sure that all of the medicines are necessary, that they know the purpose of them, they know how to take them appropriately, and if they have any questions or potential problems with them, that they have a chance to raise that. So when the pharmacists see people in our office, and we actually provide transportation if need be, or in people's homes if they're homebound, we do a couple of things. One is to make sure, of course, they know what their medications are for, but also at the end of the visit, they leave us with what we call a medication record, and it's something we print out that lists all of their medications and how they're taking them, who's paying for them, what the purposes of them are, and any allergies, adverse effects that they may have from their medications is really important, and what insurance they have, and who their doctors and providers and pharmacies are. And we ask people to keep this on them so that we try to get everybody to advocate for themselves and be on the same medication page, as we call it. About 80% of the time we first meet someone, we have to intervene in some way. Sometimes it's just being in touch with their provider about a concern we have. Sometimes it's because they simply can't afford the medicines they need. So we try to equip them with a medication record and something called an action plan, where we list 1 or 2 steps that they need to take or be engaged with to make sure that their medicines are really helping them out. One of the big things our pharmacists have learned to do over time, and seems really, really important this day and age, because the United States and New Zealand are the only ones who allow direct-to-consumer advertising. So we're sort of constantly having to coach people that there are many things that they can do without medications that could improve their health. So we talk to them about other things that they can do. For example, avoiding caffeine that comes in chocolate or tea or that kind of thing after lunch, and or making sure you wake up at the same time every morning. It's a simple step you can take not to sleep in, to make sure you wake up every morning, even if you're sleepy. Try not to nap during the day. So our pharmacists spend time talking about really practical things that people can do to improve their health without having to use the medications. So it's really important to us that we help people access the medications they need, but avoid the ones they don't need. And that's why medication therapy management or medication reviews are really central to a lot of what Senior PharMassist does.